Good morning, everybody, and thanks so much for joining us today. I'm Jeff Gold, and I have the honor of being the Chancellor here at the Med Center. And I'd like to extend a very warm welcome to all of you to the Sorrell Building here on the Med Center campus. Can you all hear me okay? Just double checking. Let's hope so. So this press conference is part of the frequent and communications system that we have used to try to bring helpful information to the community and to be as transparent as possible in sharing the current status of what we are doing here at the Med Center, but also to provide some regional and national perspective as well. Of course, we're gathered here to talk about what has been affectionately known as the novel coronavirus or the COVID-19 spread. This is a special day for several of our guests here today. I'm going to introduce them to you in just a minute, and that is after their official biocontainment and isolation and quarantine period. They are going to be able to travel home. The two guests we have today were quarantined here in our facility and are going to be able to join their family in their home. But it's also a bittersweet moment across the world and even in our nation as the number of cases is scraping precious close to the 90,000 number. The number of deaths is precious close to 3,000. And indeed, if you look at the number of states that are now reporting community spread of this disease, the numbers continue to go up and up and up. The University of Nebraska Medical Center and Nebraska Medicine have been ready and continue to be ready for this in terms of our spectacular workforce, the partnerships that we've established with the federal, the state, the county, and the city communities that we serve, our world-class facilities, the supplies, equipment, and technology, the testing that we've developed here are absolutely state-of-the-art. Indeed, together, the people you see in this room and many, many others are planning for the future and such additional situations that may arise, both short-term and long-term. While there is uncertainty around this progression, and we all certainly hope for the best, we plan and plan and plan with our global community to deal with whatever eventualities may be in place. We do this by strengthening the workforce, by expanding facilities, but by using fact-based communication with as much data as possible to share the information in ways that are helpful to the communities that we serve. We are incredibly grateful for the teamwork with the federal, the state, the county, and our city colleagues. It absolutely takes a village to do this. Before we open it to questions and initial statements, I'd just like to introduce the panel to you. We have Dr. Michael Wadman, sitting immediately to my left, Captain Dana Hall, Shelley Schwedhelm, just looking down the row there, Angela Vasa, and then our two guests who are going to be leaving Nebraska today, unless you decide you want to take up state residence, we can always accommodate that, Ms. Joanne Kirkland and Ms. Jerry Sarati Goldman. There are a number of other people that are here today. I could go through a long list of dignitaries, but I would like to recognize at least Dr. James Linder, the Chief Executive Officer of Nebraska Medicine, Ms. Amy O'Keefe from the Douglas County Health Department, the representatives of Congressman Bacon's office, many, many, many others who are actively involved on an hour-by-hour basis with all of the things that we do here to try to not only care for the patients that we've had the privilege to quarantine, isolate, and care for, but also to provide useful information here across the state of Nebraska, but on a national and on a global level as well. And so with that, it is my pleasure to introduce our first speaker, who is Governor Pete Ricketts, who of course needs no introduction, but just for me to say, Pete, personally, how grateful we are for the relationship and all of the teamwork that's made this possible. Governor Ricketts.
All right, so good morning, everybody, and thank you very much, Dr. Gold, and thank you all very much for being here. So first of all, I want to thank the staff, the facilities here at UNMC, all the great healthcare workers who have been taking care of our guests. They've been doing a fantastic job, and these folks are the experts in the world at taking care of infectious diseases. We have the world leaders right here in Nebraska. And so I want to thank the team that has been working with that. I want to thank President Trump and Vice President Pence for their action to be able to take control of our borders and distribute information. And then, of course, I want to thank Dr. Gold and UNMC and Nebraska Medicine and all the folks here for being able to help make sure we're taking care of Americans and being prepared. Our goal here at the state of Nebraska is to be the best prepared state to be able to deal with the coronavirus. And so we want to continue to get that message out to people to be prepared. First of all, just in your daily habits, we want people to make sure that they're washing their hands, avoiding touching your nose and face and mouth and that sort of thing. And then just like any other organization or organization's families, be prepared. And the way I want people to think about this is think about this as a really big snowstorm that is about to hit us. Okay, we all know when we have to deal with a snowstorm that we may have to be stuck at home for a few days and that sort of thing. Well, it's the same kind of thing with this. If you are sick, stay home. Don't go out. Make sure that you're self-quarantining, so to speak. Don't go out and make other people sick. And again, what we want you to do is be prepared so that if you're a family and you're thinking about, well, I may be stuck at home for a while, what are you going to do about childcare? Do you have you stocked up on provisions, that sort of thing? If you're an organization, you should be looking at your continuity plans to say, well, what am I going to do if some of my people can't make it into work, right? This is what we're talking about, is think about this like a really big snowstorm, and organizations and families need to be prepared. At the state of Nebraska, we are doing the same thing. We are looking at our continuity plans. We're looking to see what we're going to be able to do with regard to this event that is coming at us, and we want to make sure that we're prepared. Everybody should just take this, for what it is. This is, going to be a really bad flu type season if, as the coronavirus continues to spread. We see it in other states. We want to be prepared here in Nebraska to be able to handle it. The state of Nebraska is also continuing to track the folks who have been to those 9 different countries, so we're watching from that standpoint. And then we're in constant communication with our federal partners who have done a fantastic job on this. So we're continuing to stay educated on this. We're distributing information as we have it. But I think the big key is that the key message we want people to get out is, A, if you're an organization or family, be prepared like this is going to be a big snowstorm. And continue to practice those good hygiene habits. Make sure that if you're sick, stay home. If you're coughing, cough into your elbow or into a tissue, throw the tissue away. Wash your hands regularly, 20 seconds. We want to make sure that you're doing a good washing your hands frequently and making sure that you're just thinking about that good personal hygiene. As you saw, Dr. Gold and I did an elbow bump here, right? So we're just trying to practice that good hygiene so that we can mitigate the effect of the virus spreading. So with that, I'd like to turn it now over to Congressman Fortenberry, or back to you, Dr. Gold.
Go.
I'm going to turn over to Congressman Fortenberry. He's going to say a few words.
Thank you, Governor. Ready? Good morning, everyone. Thank you. This morning when I walked in, I met Jerry and extended my hand, and she went and gave me the elbow bump. So you are now the ambassador to America for the new sign of greeting and welcome and friendship, okay? Jerry and Joanne, you're free. Thanks for staying with us, but I'm glad you're well. And we hope your visit was obviously successful, and clearly from the reports I read, the entire University of Nebraska Med System was very generous and kind and welcoming to you. So I hope your experience was optimal.
Amazing.
Yeah, thank you for saying that. I appreciate it. And let me go ahead and thank everybody who has been involved with the care of many Americans who, not through an act of their own will, but ended up here, particularly under Dr. Gold's leadership, and all of you. Thank you so much. We're very, very grateful. Nebraska has stepped up to the plate. We've helped lead the nation in the response to the coronavirus, as the governor rightly said, and we're happy to do it, first with our National Guard facilities being open, and then UNMC being on standby, on watch, ready. And there's a long history to this. During the Ebola epidemic, again, the University of Nebraska Med Center provided a tremendous leadership role in response to the worldwide crisis then. There were federal funds moved this way to a consortium working in a bipartisan fashion. We were proud to be able to help position the university to become a leader in this infectious disease containment space. In that regard as well, I'm very proud, again, under Dr. Gold's leadership and with the leadership of Governor Ricketts, to continue to think creatively as to how we have a surge hospital concept ready for our military, ready for our citizens should there be a pandemic. And again, the University of Nebraska, I think, is very well positioned to help lead the nation in this regard. We've had multiple conversations in Washington ongoing right now, and then will be ongoing throughout the year as we develop a budget as to how we may, again, creatively align our military, the Department of Defense, Health and Human Services, to be ready for this type of response in the future. Again, a 21st century architecture for thinking about national health security. There's a third issue here. I don't want to touch it too much, but it does beg the questions, and maybe some of you in the media and I can go into this later, as to supply lines for both drugs as well as medical equipment, a lot of which is attached to the dynamics of production in China. And so there's some questions that have been blown open by the spread of the coronavirus. I am pleased, very pleased with the administration's response as well in Washington. We're all trying to get a handle on just how intense this is and where is it going to go. There's clearly a lot of questions in that regard. But nonetheless, back here at home, University of Nebraska, the state of Nebraska playing a lead role for America and for the international community to take care of those hit with this virus and to think constructively as moving forward what type of vaccine there may be or future facilities for the containment and care of people who may be exposed to this or something else. Again, creates an important duty for us, given that we do have facilities that are on standby and ready to be built out further in the future. So with that, thank you very much today for inviting me today, Dr. Gold.
Well, thank you. And before we open it to your questions, what I thought I would do is invite our panelists, but particularly our two guests who will be heading home later today. Did you want to make any comments before we allow the community to ask you?
For myself, this has been an amazing experience. The way that the staff treated us, you know, friends are saying, oh my gosh, how can you do it? It was seamless. This place is special, and you guys should be very, very proud.
I also agree. It has been wonderful. We've been treated with nothing but respect. I have been in places before that you could be quarantined and when people come in to see you, they act like that they're going to maybe fall over dead in the next few minutes. But that has happened in my lifetime, but this has been amazing, and you all I have a lot of respect for all of you, and thank you.
So great to see everyone's faces, because when we were greeted from the plane coming from Fort Travis, these two faces were there, and we were so tired because it had been such a long, horrendous time getting off the ship and getting from Fort Travis to here. And then these two guys greeted, and it was like, oh my gosh. And we were so upset that we had to come here. We didn't understand. I'm from California. Why couldn't we get off the plane? But this was meant to be, and my husband and I are so blessed. He was the one that ended up in the biocontainment unit because he had a pre-existing condition called Guillain-Barré that had already broken down his immune system. And his treatment is, top. This is the top in the country. Very, very top in the country. You guys are blessed, and we are blessed because of all of you.
Well, thank you. And I think with that, we're going to just open it to questions on any of these related topics that anybody may have. We'll try to be as respectful of your time as possible.
Doctor, obviously these two women have been exposed to the virus. Any reason why they didn't get it and everybody else did? Or did you find any correlation as to maybe something special about them? They're not contagious?
I mean, they're super nice people. Mike, do you want to?
Well, it has to do with all the things that have been detailed to this point as far as social distancing, staying away from folks who may be exhibiting symptoms of illness. If we do those things, we can limit the spread, and I think that was done to some degree, and that may be why those that didn't test positive did not get the infection. But I'd like to underline what Governor Ricketts has talked about in terms of preventing spread, and doing all those things to prevent spread within the community are going to be key going forward. So I'd like to emphasize that point.
Joanne, when you were told you were going to be quarantined, Was your first reaction okay, or is there a way around this?
Is there a way around this? Because I don't like to be away from my husband. So, it was scary, but being in this situation like this, knowing I can't get out, it's not like jail, and I've never been to jail, but I imagine that a lot more days of this, I couldn't take it, I don't think. But it's been wonderful. Everybody has been so kind and good to us.
Jerry, could I ask you the same question, your first reaction?
Well, we were on the ship, so we were a little shocked because we're business owners, so just trying to reschedule meetings for several weeks was a challenge. And then we surrendered. I have an Army Ranger son, and when he would get deployed, I learned what surrender truly was. So we just surrendered the situation, and we made the best of it on the ship. And then when we found out we had to do it again because of the containment and the way the ship was handled, not Princess Cruises, but I'm going to call it the Japanese ministry, that things were not contained the right way, once again surrendered and say, okay, now we're infected, and we totally understand why we had to do another 14-day quarantine, because the last thing we want to do is be of risk to anybody out there.
From a financial standpoint, I mean, you guys have been obviously not working. I know one of your husbands is working from a virtual radio, right?
Yes.
How much money, I mean, has this cost you? How much setback has there been?
Huge, because this is our very busy time of the year. We're a radio station. We're a major news portal in our community. We put on a home and garden show. We do a lobbying trip to our state capitol in a couple weeks, so huge financial impact on us. We're the salespeople at our business, and there's been no new sales done. I tried it. The hospital was great with hooking me up to my computer, and I worked probably longer than I do at work every day because it was ongoing throughout the day and the time difference.
Jerry, I know you've been waiting for this day to get out, and we appreciate you talking with us. I know you've talked to many people here. It must be bittersweet, though, for you to be leaving and your husband to be staying.
You know, I woke up this morning, and it was like, oh, I should be doing a happy dance, and I wasn't doing a happy dance. I was doing a sad dance. So it's bittersweet.
What can you tell us about his condition, and what types of symptoms has he expressed over the past weeks?
You know, it was interesting because we were on the ship with two other friends, and we had a shared balcony. So during the first 12 days, we were all together. And the healthiest out of all of us, we're all very healthy, she was the first to test positive. Her husband was a double kidney transplant, so they tested him right off the bat because of the meds he took. And the day after Valentine's Day, she got the call that she was positive. We were shocked. She had 1 hour to get off the ship with only being able to take a backpack. So her only symptoms were about 4 hours of fever gone. And she's been getting up at 1:30 in the morning and doing a Pilates class with her friends in St. George, Utah. Her husband tested positive several days once he got to Fort Travis. So he never got it on the ship in Fort Travis. He tested positive. So we're thinking maybe the flight, the bus, we don't know. And he's had no symptoms whatsoever. He's at Intermountain Medical Group in Utah. And then my husband, he had a fever, a very high one on the plane that came out of the blue. And I think had a fever for several hours, broke, low grade, And he's been, other than a cough, I mean, like he said, this is not even like a flu because he has no symptoms other than a cough and other than the fever. So it's very deceptive what this does.
Joanne, was there any point in this process where you seriously questioned the preparedness of, whether it was over in China or, the U.S. here? Was there a moment where you really questioned the preparedness?
No, it came up so fast, I wasn't expecting it, so I never really thought about that aspect of it.
Where is home for you, and tell me about a normal day during these 14 days.
I'm from Knoxville, Tennessee, and my husband and I both are retired, so we do a lot of traveling. We like to travel, and if we're sitting home and decide we want to go to Nebraska. That's what we
And we do hope you come back.
We
do hope you come back.
We do. That's what we do.
Can you guys talk a little bit about what it was like on the ship, especially when you found out what was going on?
For me, it was the shock. I was just in shock. I just didn't think about having a virus on the ship. I just didn't. I felt safe.
So just to update everybody,
Yes, we were.
just to make sure everybody knows, these are not the first two guests that have gone home. Several went home yesterday. There are probably others, depending on testing, that will go home this week. And maybe Shelley, you'd want to comment on that.
It was very uneventful yesterday, and they had 3 consecutive negatives 24 hours apart, so we were able to get them out yesterday and headed home.
How many have left?
2 yesterday and 2 today. So 4 of the 15, so we have 11 remaining.
Correct.
Are you anticipating more coming in to the Med Center now? Or?
At this time, today, right now, no. Is that possible? Yes. But we know of no current missions or requests.
With the arrival of the virus in a bigger way in the United States, is there a scenario where you see yourselves being utilized for people within the United States, or are you still going to be likely used for people who are being repatriated?
So let me just say, currently an extensive amount of training and education, information sharing, best practices widely across the country, but particularly in Washington, Oregon, California, and globally for that matter. In terms of clinical utilization, not currently. We'll see.
I think repatriation is less likely at this time, but I think more so, yes, if there are states or regions, we're still really very much about containment, although I think that's going to quickly change as more and more cases evolve. So
other than use of it for people within Nebraska, potentially, under what scenario would either the quarantine or the biocontainment unit be used compared to these cases?
So if our federal partners asked us to take folks to quarantine, we would definitely discuss that and entertain that. We are the Region 7 treatment center. There are 10 across the U.S., so we are the Region 7 Iowa, Kansas, Missouri, Nebraska treatment center. So if someone in our region wanted to utilize our services, that would also, early in the onset of this pandemic, be an option.
So 4 of the 15 left yesterday, and then these 2 that will make 6.
No. 2 yesterday,
Two today.
these 2 today, so there are 11 remaining.
Ladies, did you know each other before this whole thing?
An hour ago.
And and Joanne, do you mind if I ask, is your husband here?
He's in the quarantine.
Okay.
He's
still in the
quarantined.
quarantine
Yes.
as well
Yes.
as your husband, Jerry. Okay. Okay.
He was positive and I was not.
We're the only 2 negative people
Negative.
in Nebraska from the ship.
You say 2 were released yesterday, 2 today. Do you anticipate 2 more tomorrow, or where do you stand with the other patients?
Well, the testing regimens are ongoing now, and so I wouldn't really be able to tell you exactly numbers and dates when they would go home. That all depends on negative testing. But there are potentials that would be able to go home this week, pending negative testing.
So you have others that have already tested negative twice, and hopefully today will be the 3rd time?
Well, as far as the numbers, there's a variety of different testing sequences going on, depending on when they ceased having symptoms, did not have a fever. They're not all on the same timeline. So it's difficult to say exactly when people will be going home, but there are several that would have potential for 3 negative tests and then home this week.
What do you know about COVID-19 that you didn't know maybe 2 weeks ago by having some people to examine?
I think, being around the people who have the infection and observing symptoms, and I think that Jerry mentioned that fever and cough being the most prominent symptoms, that we've definitely seen that. Not as much nasal congestion, sore throat, myalgias, GI gastrointestinal type symptoms that we see with other viruses. So I think that's one thing that we've definitely seen. I'd like to say that the folks who are in quarantine, that they're thanking us, but I'd like to thank Jerry, Joanne, and everyone else for being so cooperative and so gracious, in a situation where they are, very much their freedom's been taken away, been compromised. That they've been very cooperative and very easy to work with, and we really appreciate that. I've also learned that we mentioned the support that they need during quarantine, and I think we've had excellent support from folks with Nebraska Medicine Behavioral Health, and particularly David Cates running our town hall, giving them strategies for dealing with the situation and helping our staff. And so those are the main things I think I'd take away.
A lot of the questions we're getting is, a lot of people will say more people die from the flu. What is it about this specifically, COVID-19, that concerns you the most? Or what is it that you can relate to people that are watching that shows the difference between, is it the spread, is it the mortality rate?
Maybe I can just take a little bit of that and then let Mike and others comment. What we know about this is that it is not exactly like the flu. It is slightly more infectious, probably 1.5 to 2 times more infectious than the flu. The prodrome, or the incubation period, is longer. Flu tends to be a matter of 2 to 3, maybe 4 days. This can be 10 to 14 days. The duration of the illness appears to be somewhat longer. Flu hospitalizations, for instance, tend to be 2 to 3 to 4 days. We're dealing with hospitalizations here that can be as long as a week. ICU utilization, intensive care unit utilization, seems to be somewhat higher as well. And also the period of virus shedding that occurs after people are well and they're ready to either be discharged from hospital or go back to work. It appears that the period of virus shedding is somewhat longer as well. Those are at least that's what I think about when I compare and contrast this to the flu. The flu mortality rates are a small fraction of a percent. The numbers that are being quoted, at least from China and from other parts of the world right now, are roughly in the 2 to 2.5% range. Granted, that may be a very skewed number because we don't really know how many people are infected. If 10 times as many people are infected, it's not 2, it's 0.2. So only time will really tell. But other thoughts?
I think that is a great summary. I agree with those points.
Well, I mean, I think the one thing is that we're all nascent. There's no immunity to it, and there's no vaccine yet. So there's everyone could be at risk for it.
And I think that is exactly what I would emphasize is we've got a short period of time where likely the cases will exponentially increase. And with no vaccine, then you're talking about a lot of people. And of those, like we've mentioned, a very small percentage will have severe illness or even fatality. But when you look at no one has immunity to it, that's a lot of people. So we just need to be mindful of that and really do our best to implement certain things that would be helpful to mitigate that, which might mean social distancing and perhaps stopping large-scale events and things like that. And I know no one wants to hear about that, but those are the things that are going to be really important to really slow it down in communities where the prevalence starts to happen.
Captain Hall, with the events that have unfolded on the West Coast, is there a kind of different mindset that public health professionals are ratcheting up into? I know you've thought about and trained for this type of thing, but this past weekend seems to have taken it to a little bit different level for this country.
I mean, I think our public health measures are consistent across the nation. We were focusing on containment. Now we're focusing on mitigation. So those are the same public health practices. So regardless of where you are in this country, that's what we're working toward. And again, the social distancing and really emphasizing that. And so nothing's changed between here or the West Coast.
For a lay audience, explain what you mean by the difference between containment to mitigation.
Well, mitigation is like preventing the spread of the disease. I mean, containment is, containment is preventing the spread of the disease, and then mitigation is lessening the impacts from the disease. So we're moving now towards more of a mitigation phase, where we try to delay the onset and push it out through these behaviors that we're emphasizing: the social distancing, the hand washing, the teleworking and distancing ourselves from each other.
Do we know yet whether people could still test positive later on, or develop this later on? There's been cases in Texas, apparently a case in San Antonio where someone was released from quarantine, later tested positive. And do we know, even if you're positive, if you still are positive and have the bug in your system, can you then spread it still, or do you know any of those?
Well, I think that's why our testing regimen is what we're following, is to try to lessen that risk. And so far we worked with the CDC, with ASPR, to put together the testing regimen that we have in place. And I think that with the 3 negative tests, we feel confident that the folks can leave after that.
Do you think there'll come a time when we have to stop meeting in large groups? And I ask that question because the NCAA is talking about playing basketball tournament without fans. I mean, have we reached that point, or will we reach that point?
Well, I mean, it depends on how many cases we're seeing in the community, and if we are seeing cases increase, then those are the types of measures that I think we all need to prepare for, whether it's NCAA basketball or schools, churches, other areas where people are getting together. And so that's, I think, the conversations that should be going on now within communities.
There are just multiple different predictive models, and until we have a little bit better clarity as to the rate and the direction that this is going to change, it's going to be very difficult for the NCAA or anybody else to make these decisions. But just coming back to Governor Ricketts' metaphor of the snowstorm, you don't want to start stocking up and putting the chains on the tires after there's 6 inches of snow on the ground. You really want to prepare as best as we possibly can before it starts to snow. You look at things like tornado warnings, hurricane warnings, flood warnings, things along those lines. We've gotten very sophisticated in this country that we're working very, very hard to be able to predict the timing and the severity of these types of events. But the whole reason we do that is to get ahead of them, not to have to play catch up. And that's all the effort that we are engaged in, and that our federal and our state partners are so actively engaged in.
I don't know. Last week, the administration, some of the officials were using words like describing the response to this as a hoax and the like. Has that been counterproductive for the messaging that this group has had?
I'd rather stay away from the politics of this and be focused on the facts. The facts are that we don't know which of the models are going to be the largest and most prominent or prevalent in the United States. We've spent an awful lot of effort on the containment phase of this, which I think is appropriate in the early stages of it. And now we need to move towards the mitigation stage of this. And I think as a nation, we are moving, and all of us across this table, myself included, are tightly tied on the federal, the state, and on the county level. And I think that is the philosophy moving forward. And I ask our colleagues to comment, but
I think our public health folks also have great surveillance of what's happening in our community and our state. So we'll continue to rely on those, just like we do during influenza season. And I would also just say that none of what we're talking about from a pandemic preparedness perspective should be surprising. We should all be doing business continuity planning day to day in our businesses and in our healthcare facilities, and we should also have a pandemic plan. So this is a potential thing that we always work around. So now's the time to really update those assumptions in those plans and start making sure that the strategies we've identified are going to be successful, given the modeling.
I understand that physicians here are working on a drug to treat COVID-19, and a patient here was one of the first to receive that drug. Can you talk about that? And the update with that also.
Well, that's correct, that there was a patient who was enrolled in a study to use an antiviral to treat COVID-19. It's one patient is my understanding at this time, so a little too early to draw any conclusions from that. But I think that we do need to continue to go forward with those types of tests to be sure we can identify those types of treatments, and then also, looking into vaccines and developing those, which is underway, and we're hopeful that that'll progress quickly.
Did our elected leaders leave? Are they still here for questions, Governor Ricketts? They had to go?
They had other meetings.
Okay.
Question for Jerry and Joanne. I don't know how much time you've put into this. I was curious, have you thought about once you touch down at home and you're finally in your own homes and beds, what are the first couple of things you want to do? Have you thought about what you just wanted to do?
Well, my kids we can talk to on the phone and FaceTime, so that's not been an issue for me. It's just my doggies. My doggies, my bed, and a bath. In that order.
My children will be at home waiting on me, except my son is in Dubai, so, and he worries about me. My only question is will my friends shun me when we go back, or just the community in particular? Will they shun us, be afraid of us?
Is it scary to think that? I mean, are you afraid that that might be a perception when you do make it back home?
Our community is wonderful, and we're all close knit and everything, but I try to think how I would feel if it were them and they were coming. I don't know. That concerns me. But we'll make the best of it.
You both, I know, I've watched your guys' Facebook Lives. I feel like I know you guys. What is, the tool of social media been able to, at least keep you busy throughout this few weeks?
Well, for me, I had poor words when I did an interview the first couple days getting back, where I said that we had, quote, made up a story. So what that meant was that when we were on the ship and we were not getting our test results back, my husband, our friend, and myself made up the story that if no news was good news, which turned out to be the case. So unfortunately, that spin's been spun off the universe. They've made YouTube videos, and that's been very disheartening because I've gotten a lot of threatening hate mails, hoping that I die. Social media, we've had to block. That's been crazy and very disheartening too.
And I think to add on to that, I think when we talked about the town halls and implementing behavioral health support services, that's key for all of the individuals who are here in our care. So what are the things that you can do when you get home to make sure you're maintaining good mental health support, reaching out to friends and family, and I think maintaining contact with those of us here. So if you have challenges or concerns, we're still available to answer those questions. And that relates back to our staff as well. So our staff who are providing care in both the biocontainment unit and within the national quarantine unit for isolation and quarantine, we try to make sure that they have those resources available as well, so we can educate other hospital workers, our community, our friends, and our family, because those fears and those reactions could be prevalent and possible for anybody who is involved in this response.
How many days has it been since you've been home? If you go count, when you left to get on the ship.
21, I think.
From
21 days.
We left January 17th. So, yeah.
So it feels like quarantine.
Absolutely.
Dr. Gold, there's been some question about the number of testing kits available across the country. Some states are complaining they don't have enough. Do you know what the status is here in Nebraska and the region?
Yeah, so we could potentially be limited, but we've not only used the federal kits, but we have our own testing system that runs through the Nebraska Public Health Lab, which has been now authorized by the CDC to test. So there's I don't know the exact number, James, 3-5 in the country that are authorized currently?
I think less than a dozen.
Less than a dozen. And so we are not concerned. There was initial some potential issues on the efficacy and the accuracy, but I think that's all behind us right now on the national level. And I think we're seeing much more widespread testing. I was actually out on the West Coast early part of the weekend, and there's a lot more testing that's being done in the Washington, Oregon, California area, as I'm sure you're aware of just from reading the local news media broadcasts. I think, the the consequence of that is the more we test, the more we find. I think we saw that in China. You may remember they went through a series of changes in the way they test and made diagnoses, and as they started to test more and diagnose more, the numbers started to really uptick in a hockey stick sort of way, and it wouldn't be surprising if we start to see that as we see more testing in this country. There was a recent report from the West Coast based upon mutation rates of the virus, that they actually thought the virus was present in their community for somewhere between 4 and 6 weeks, I think was the number that was published. If that's the case, at a 7 to 10 day doubling time, that tells you there are probably hundreds of people that have either been exposed to or had a minimally severe infection from the virus but could communicate it. So I think those numbers are going to show an uptick across the country, and we shouldn't be surprised if we start to see that.
Dr. Gold, you talk about being prepared and, you know, having food and everything in your house as you would for a snowstorm. Are there certain medicines or certain foods that they also should stock up on that might help alleviate the symptoms or make you know, the healing process come around faster?
Well, with the advice that I've been giving family members and friends, you know, coming from a recovering heart surgeon may not be too valuable, but what I've been telling them is mostly stock up on the medications that you personally need. For instance, if you're a diabetic and you're taking insulin, make sure you got enough insulin around, you know, and whatever your medications might be. But let's ask our colleagues here as to whether there are any recommendations on magic elixirs to blunt the course of this.
Fever-reducing medications would
Yeah.
be good.
Yeah, I would echo.
So that would be what, Shelley? Just to give the audience a couple of names.
Tylenol, Advil, Motrin, aspirin.
Those sorts of things.
Yeah, I would echo that, and especially to make sure that they have a supply of the home medications that are critical for any chronic diseases that are being treated. But other than that, it's symptomatic management.
People talk about bottled water, canned goods, those sorts of things as well.
Moving to the, I guess, looking to the future a little bit here, you know, medical providers and health officials are the kind of the first people to be in contact with, you know, people who have the coronavirus. If this were to become a larger outbreak and people were to be self-quarantined, would there be some kind of at-home service that UNMC is planned for, I guess, to kind of, you know, meet the people at their homes?
Yeah. So really working collaboratively with public health is the goal. So for folks that don't really require admission to the hospital, self-isolating at home is a great strategy, great option. So there's a lot of guidance already out there on cdc.gov website, and local public health departments are really doing a lot to promote that as well. So there's lots of resources and information.
And we've been having discussions as far as if there were, when and if there's community spread, to try to keep mild illness out of the emergency department and to route them to clinics that would be specifically designated to perform assessment and testing for COVID-19, so that we can not, you know, have transmission within our healthcare system. We can separate that flow, give them the treatment and care that they need, the testing they need, and then partner with public health to make sure those test results are followed up and acted upon appropriately in terms of quarantine.
The other thing we do is we screen folks for influenza-like illness, fever, cough, rash, things like that as they enter the health system at all of our front desks. So we quickly invite them to put a mask on if they have any of those.
You know, another question we get asked frequently is what about the people who work in these units, and how do we monitor and track them? And maybe Shelley or one of you would just comment just to make sure that the audience understands how thoroughly and carefully we do that.
Absolutely. Thanks, Dr. Gold. So we do have a system set up that we built with our local public health department. We use an electronic system. So every healthcare worker or healthcare professional who comes into contact with an individual that's been confirmed to have COVID-19 is entered into that system. So we ask them to submit temperature and report presence or absence of any symptoms that would be consistent with the virus. And they do that twice a day, starting at their first patient care contact and up to 14 days after their last patient care contact. So every healthcare worker that we have that's been involved in the care of our individuals is enrolled in that system. They get a text message alert, and they can add that information directly from their phone. And then they get reminder alerts up and for a couple hours afterwards, and then if they are not able to enter it by that time, they get a phone call. And so all of our staff are versed on that. It's part of our onboarding and orientation, and so this is nothing that is surprising to them, and it's something that we do to make sure that we can reassure our staff, their coworkers, their friends and family that we're monitoring them, and that we would have early warning if they would develop any of those symptoms consistent with COVID-19.
Is that part of the best practices you've been training other hospitals in? And if we're starting to see some of these other healthcare providers who have contracted the disease, that maybe there might be lapses in their systems. I don't want to single anybody out, but
yeah, we've shared this information broadly through a article published about a year ago, as well as then doing some one-on-one help with different places across the U.S. in the last few months. The other thing that we've provided is a lot of education and training on personal protective equipment. Through our National Training Center grant, we have a video, we have a one-page donning and doffing of your personal protective equipment tools. Those are on our nebraskamed.com website, but they're also on our national website.
And I don't work at UNMC, but we're doing the
Well, you
exact.
do.
Well, I am, yes. But,
We're all in the
I'm here all the
family.
time. We're doing the exact same thing that Angie described for all the federal responders. So we also are twice a day, and we're temperatures twice a day, and we get reminded. And if we don't answer, they call us. So we're all being watched.
This was all developed in the setting of the Ebola outbreak 5 years ago and has been widely implemented as a best practice. But keeping the healthcare workforce healthy is obviously something we care a lot about.
In regard to the 11 patients that are still in quarantine, is there anyone that is still showing more severe symptoms than others, or?
They're all outpatient.
At this time, they're all out of the hospital in the quarantine unit in isolation there, and to this point, some mild symptoms, none severe.
So just for clarity purposes, there are sort of three levels. There's quarantine, which is for asymptomatic, non-infected patients. There's isolation for people that are either symptomatic or infected but not sick enough to be hospitalized. And then there's biocontainment, hospital-level care, which is in-hospital care. So there are sort of three tiers to this. And then, of course, as we graduate and send you home, right?
And so where's, with the remaining patients, where do
They're all in
the
isolation.
remaining patients?
They're all in isolation.
Correct.
Because they're all confirmed to be infected, but they're nowhere near sick enough to be hospitalized currently.
Joanne, do you mind if I ask your husband's name? I know Carl is your husband.
John.
Let's see, John.
Yes.
Okay. And ladies, do you have any idea where they are in that process? Is that something you're interested in sharing, where they stand in the testing regime and when they might be able to come home
I
and
know
join you?
that my husband's testing this morning, so we're praying for a negative tonight.
And I don't know. I don't know.
Okay.
Oh, sorry, one more question.
Yeah,
I
sure.
think none of you might be able to answer this, but, there have been a lot of flights international flights that have been, stopped to Milan and South Korea, and I don't know if you've been in contact with anyone that would, have that information, whether, flights to Washington from, in the U.S. would ever be stopped.
I don't have that information.
No plans at this time. I think, there's a lot of work being done at airports everywhere to really quickly identify. Flight crews are being trained to identify people who perhaps are not feeling well on flight. So I just know there's a lot of work being done around that topic.
If you had a relative overseas right now, what would you be telling them?
I do. I have.
Go ahead.
What are you telling them?
I have 3 of my children are overseas right now. I don't know if I'm going to get to see them. I don't know, they're in another country, so I don't know what their border control is going to be like. So I know that country where they're at is working on a vaccine. I don't know, what the efficacy of that vaccine will be, but I'm telling my children the same mitigation, same strategies we're telling everybody here: wash your hands, social distancing. Those same practices. But I don't know if I'm going to get to see my kids or not, so we'll see.
Maybe of interest to you that, as you probably know, the University of Nebraska system writ large, all of our campuses, has hundreds of students that do international travel, study abroad as we like to call it, and all of those students that are in CDC Level 2 and Level 3 countries have been recalled. We have put on pause all current international study abroad travel pending the next several weeks to determine whether or not travel that's currently planned for the summer and for the fall will actually occur or not. We have recommended in Level 1 countries that the students and faculty that may be studying or working there come back, but we have not required it as yet. And you may know many of the large corporations in Nebraska and across the country, for that matter, have affected very similar recommendations. We are completely in step with what I would characterize to be the best national practices currently.